Hello, and welcome to Dermatology Weekly, the official podcast of MDedge Dermatology, where we discuss issues that most affect the specialty. I'm MDedge editor Elizabeth Mishkati. And now, your host for this week's resident takeover, Dr. Sophie Greenberg.
Hi, and welcome to this month's episode of the Resident Takeover. This is Dr. Sophie Greenberg, and today I'll be interviewing Dr. Negbenebor, who is the second-year resident at Brown University, where she also went to medical school. This is our first resident takeover of 2021, and she's one of our new resident columnists this year, so we can look forward to hearing more interviews and reading more of her articles. Today, I'll be talking to her about her article about applying for dermatology residency as an applicant of color. Hi, Dr. Negbenebor.
Hi, thank you so much, Dr. Greenberg. It's so great to become one of the new resident columnists.
We're so excited to have you today. So let's get started. I loved reading your article, and I'm really happy to be able to talk to you about it.
Thank you.
In your article, you start out by tying your personal experience as an applicant of color to systemic issues within the field of dermatology. Tell us a little bit more about this.
Yes, it's unfortunate because dermatology is such a wonderful field, and I feel that it has had the ability to impact so many different people, different socioeconomic statuses, different backgrounds, but unfortunately the workforce does not reflect the population sometimes that they're serving. I think it's in general 13% of Americans are, in particular, African American. There's only 3% of those dermatologists are Black. And the same thing goes for Hispanic population. Only 4% of the dermatology workforce are Hispanic. And so there's a gap between the people who are being seen and the people who are seeing the patients. And because of that, it leads to a lack of mentorship for a lot of students, unfortunately. And I think especially when you're applying to such a competitive field, you really want to feel comfortable reaching out to people and feeling like you have somebody who can support you and you can ask questions without judgment. And it's very hard because, especially if you didn't grow up in a family that had a dermatologist or even had a doctor or even somebody who went to college, it can be difficult to know how to navigate the entire process of applying. And one of the things that I think dermatology has been doing a good job of trying to work on is establish more mentorship pathways. But there's definitely...
So, sorry to interrupt you. I actually wanted you to tell us a little bit more about the epiphany that you had when you were at a conference for patients of skin of color.
Oh, yeah. So an epiphany I had when I went to the Skin of Color Update conference in New York was that I could not believe there were so many other people like me who were interested in dermatology because I truly was not seeing it. And in particular, the whole conference was focused on patients with skin of color. I was learning about conditions that I had never heard of. And one of the best things was that I got to speak to other applicants of color who were applying the same year or who had applied a couple of years before. And one of the best pieces of advice I got during my application process was to make sure you reach out to a mentor and somebody who could vouch for you. Which is very different than just somebody who could give you advice. And so I was...
I was just going to say, I love the story because in a way it's another student really providing mentorship to you that changed your whole trajectory.
Yes. And that student had actually applied the year before and had several interviews and had not gotten in. And so there's so much information I think you can gain from talking to other people about their journeys. And even people who are on the same journey as you.
It's so true. It's so true. And so did you find a mentor, and how has he or she helped you?
Yes, I found several mentors, and I definitely owe that to The advice that I got from that conference, honestly, just reaching out to as many people as I could. Every time I went to a conference, I would go up to somebody who had presented and said, "Hi, are you interested in being a mentor? Can you tell me more about the different projects you might have available?" And there are some direct paths that I also took to get mentorship. I did the AAD's diversity mentorship program with Dr. Amy McMichael. So I was able to do a rotation through her and also do some research as well. I also did the Skin of Color Society. They have a mentorship program for medical students, and I was able to do that and meet Dr. Jeanette Okoye, who's also amazing as well. And I also had mentors inside the dermatology department, my program director. There's so many different people. There's so many people. My chair. I mean, there's so many people. And outside of my department, also, who was a gastroenterologist who put me on helped me get a paper about amelanodic melanoma. So literally, it's kind of thinking outside the box for.
I love hearing that. And I think it's a common misconception that you have to have one mentor, one person who provides everything for you. But I've had a similar experience that you've highlighted where you have so many different people who help you and teach you in so many different ways.
Absolutely. Absolutely. And even people who you would not expect can also help you.
Yeah, that's true. Did you have any challenges in finding a mentor? And do you have advice for applicants who are looking for a mentor?
Yes. So there were some challenges, especially if you are kind of cold calling or just reaching out to people who you don't know. You're going to be met sometimes with rejections. And, sometimes people are just too busy to be mentors. And I think it's good because you want people to be honest about that, because you do want somebody who can guide you through this process. I think it's also trying to find a right fit and the balance too, as well, because you don't want to be emailing too often or come off too aggressive, but you also do want to seek help when you need it. And sometimes that can be difficult, asking for help as well.
It's
And
true.
yeah.
Yeah.
And I would definitely say that some of the best ways I think for seeking mentorship is to look into some of the societies and see if they have formal programs. That is a great way to start. The Medical Derm Society, the Skin of Color Society, the AAD Diversity Mentorship Program is great. Also look in your department, because there might be somebody who is very interested in helping students and has the time to help students, even other residents. As if you're a medical student, seeking out a resident, I think would be great, because they might have a project that they can
Yes,
help you on.
I think that's something that I've gotten when I was a medical student, and I try to help as many medical students as I can. Do
Yeah.
you have, are there ways that you've helped students as a resident and advice for residents who are interested in providing mentorship?
Yeah, I actually love working with medical students. It's so great because they come with a lot of questions. They're very interested, and it's just nice to have that passion renewed for dermatology. I think some of the top ways to help medical students has been really, if you have a project or an idea that you're interested in, or even a case report that you'd like to write up, giving medical students that opportunity to write it or work with you on papers, I think can be monumental in the process, as well as linking medical students up to other people in your field who that possibly they could also give mentorship to as well. Creating a network, I think, for
Yeah,
other medical students can be
that's
helpful.
true. And that can help prevent them from having to cold call and get more rejections.
Yes, absolutely. And I had a couple of residents who did that for me as well. So I
That's
think,
so wonderful.
yeah.
And I know you talked about some of the opportunities available to minority medical students who are interested in applying dermatology. Was there anything else that you could tell us about now so that listeners can seek them out?
Yeah, definitely. So I was a part of the SNMA, or the Student National Medical Association, when I was a medical student. I think it's very important to stay connected with them as well. And there's the resident or faculty level position of that called the National Medical Association, and they have the dermatology section, which is run by Dr. Kindred. And that's a great way to network with other people from the West Coast, East Coast, Midwest. It's great. And you get to meet other people who are applying to dermatology as well. The Skin of Color Society is amazing, and they always have grants and different mentorship opportunities. So I would definitely get involved with that early if possible. The Dermatology Interest Group is great, and most schools have a chapter, but even if your school doesn't have a chapter, I would reach out to the nearest chapter available. And then, of course, the American Academy of Dermatology with their diversity mentorship program. That was amazing. Truly, it was amazing. So I would definitely seek that out as well.
That's so wonderful. I'm so happy that all of your experiences and everything you've done to figure things out along the way can now be formalized and help other people. So thank you.
Oh, no, thank you.
Is there anything else that we didn't touch on that you think would be helpful to students?
I think one of the biggest things is that even if you reach out and you feel, or even let's say sometimes you might even get feedback that's a little bit more disappointing, take it, digest it, and use it to improve yourself. Don't take it personally. And even if somebody tells you that you're not going to get into dermatology, don't listen. Don't listen. Believe in yourself, because I think especially when it seems like you're already climbing up such a large mountain, and you might be the only hiker up there. There are people who can help you who are already at the top of the mountain. So seek them out. And even if people are not as supportive, there are people who are going to be supportive. So just keep going until you find those people.
I love that. So med students who are listening, seek out the other hikers who can help you. That's a great analogy. Well, thank you so much, and thanks to our listeners for tuning in to this week's Resident Takeover.
That's it for this week's episode of Dermatology Weekly. The peer-to-peer portion of the show is produced by MDedge editor Melissa Sears and editor Alicia Saunders. All of our podcasts are produced by Nick Andrews and MDedge editor Kathy Scarbeck. I'm MDedge editor Elizabeth Mishkati, and this is Dermatology Weekly.